As we age, our bodies become more delicate, and certain medications can have a great impact on our health, especially our brain. Welcome back. In this video, we are going to talk about a common medication group that people over age of 65 should avoid. This type of medications are known as anticholinergics. This medication group slows brain function. They can cause or worsen memory loss, and they have been linked to developing Alzheimer's or other forms of dementia. There are many commonly used over-the-counter medications that are anticholinergic, such as Benadryl. They are used to treat insomnia, anxiety, muscle spasm, overactive bladder, incontinence, motion sickness, and symptoms of Parkinson's disease. Now, you might be asking, what does it mean for medication to be anticholinergic? An anticholinergic is a medication that has ability of blocking or diminishing the effects of a neurotransmitter called acetylcholine. This is a very important neurotransmitter that your brain cells need to communicate with each other to help you remember, think, and use your brain for other cognitive functions. It's also widely used outside the brain. It is used in the parasympathetic nervous system, which generates a lot of your rest and digest functions in your body. Anticholinergic drugs often have side effects such as dry eyes, constipation, and dry mouth. Even though these side effects can be problematic in elderly, the most concerning is decreased brain function, which can manifest as sedation, confusion, or memory problem when acetylcholine is blocked in the brain. This can cause or worsen memory loss, and it can worsen the symptoms of Alzheimer's or dementia. Also, because it makes people drowsier and slower, it can increase fall risk. In fact, research has shown that chronic use of anticholinergic drugs is linked to increased risk of developing Alzheimer's later in life. Now, let's go through the 8 types of commonly used anticholinergic medications. These medications are on what we call BS list, which is a list of medications that older adults over 65 years of age should avoid or use with caution. Number 1 on the list is sedating antihistamines. These are available over the counter in pharmacies, drugstores, and grocery stores. The most common one is diphenhydramine, with brand name Benadryl, or hydroxyzine, brand name Vistaril. So, if you're having allergy symptoms, I will recommend using a non-sedating antihistamine such as loratadine with the brand name Claritin, because they are much less anticholinergic and safer for aging brain. Number 2 is the PM versions of over-the-counter painkillers and cough medications. These are medications like Advil PM, NyQuil PM, and Tylenol PM. And this is because the PM in these medications come from mixing a sedating antihistamine with analgesic. So, next time you are in a drugstore, look at the ingredients on these products. You will see that they include either diphenhydramine or doxylamine, which is another sedating antihistamine and strongly anticholinergic. So, if you want to manage pain, I will recommend taking the straight-up painkiller. Number 3 is over-the-counter sleep aids such as Unisom. If you look at over-the-counter sleep aid ingredients, it's generally just diphenhydramine or doxylamine. Therefore, if you're having sleep issues, I will recommend talking to your healthcare provider about another way to manage your sleep that doesn't involve this type of medication. Number 4 is overactive bladder medications. Overactive bladder is a urinary issue that is very common in older people. Therefore, many older adults have been prescribed a bladder relaxant such as oxybutynin, brand name Ditropin, todorodine, brand name Ditro, or solifenacin, brand name Vesicare. Unfortunately, all these overactive bladder medications are strong anticholinergics. Sometimes taking these medications is necessary and not completely out of the question to use them, but it is something to keep in mind. It is important to ask your healthcare provider of other ways to manage overactive bladder symptoms before you use these medications chronically or in person with memory loss symptoms. Number 5 is medication for vertigo, nausea, or motion sickness. Vertigo is a condition related to inner ears where people have a feeling of spinning around or floor tilting. Historically, a medication called meclizine with the brand name Antivat has been used to treat vertigo, but there are a special form of physical therapy that can also treat vertigo. Be aware that a condition known as orthostatic hypotension can mimic vertigo. Orthostatic hypotension is when your blood pressure drops after standing or sitting from a lying position, which can cause lightheadedness. Orthostatic hypotension cannot be fixed by meclizine, but by adjusting blood pressure medications. When it comes to nausea or motion sickness, you have probably heard of a medication called dimenhydramine or brand name Dramamine. This medication is quite anticholinergic. It is okay to use it occasionally, but it is something to keep in mind if you're using it often. Number 6 is tricyclic antidepressants used for nerve pain such as amitriptyline, brand name Elavil, and nortriptyline, brand name Pamela. This group of antidepressants have strong anticholinergic effects and has fallen out of favor for treating depression due to availability of newer antidepressant drugs. But this older class of antidepressant is also used to treat nerve pain related to diabetic neuropathy or post-shingles nerve pain. Since we now have better medications to treat nerve pain, I would recommend talking with your healthcare provider to see if there is an alternative to manage whatever the tricyclic drug was prescribed for. Also, when it comes to shingles, the best way to prevent post-shingles nerve pain is to get a shingles vaccine. Number 7 is muscle relaxants such as cyclobenzaprine, brand name Flexeril, and ofenadrine, brand name Norflex. These are often prescribed for neck and back pain. These muscle relaxants are quite anticholinergic and should be careful about using them often, especially in older adults. If you're taking these muscle relaxants, talk to your healthcare provider about other ways to manage your back and neck pain. Lastly, number 8 is an antidepressant medication, paroxetine, brand name Paxil. This drug belongs to a group of antidepressants called SSRI, or selective serotonin reuptake inhibitors, and they are used for depression and anxiety. Paxil is the only medication in this group of antidepressants that is anticholinergic and should be avoided in geriatric patients. And that covers the 8 most used anticholinergic medications that should be avoided in geriatric patients. The list is not exhaustive as I have focused on medications that are used often. Also, there are many medications that are used in hospital settings that are anticholinergic. I will include an additional medication list on the description below. Who should avoid anticholinergic medications? Number 1 will be people who have been diagnosed with cognitive conditions such as dementia. Number 2 will be people who are concerned about their memory and are experiencing memory or thinking problems. And number 3 will be people who want to minimize their risk of developing Alzheimer's or other memory conditions later in life. If you're taking any of these anticholinergic medications, it is essential to discuss them with your doctor and explore some alternatives. In some cases, there are no good options for managing certain symptoms or conditions without anticholinergic. If this is your situation, your doctor can evaluate the risk versus the benefits of continuing the anticholinergic and find other ways to maintain your brain health. Remember, your health and well-being matters, and proper medication management is crucial. Therefore, let's prioritize our older adults' health by avoiding unnecessary risk. Thank you for watching, and don't forget to subscribe to my channel for more valuable health information. Until next time, stay healthy, and remember, health is the greatest wealth.